Good morning, students.
Good morning, sir.
Yes, Missy.
Good morning, sir.
Sono,
Good
yes.
morning, sir.
Good morning, yes. Study of population. Previous class we had been learned that population control. Population have been controlled by the family planning. Family planning is part of family welfare. Aim to control the population, which means aim to unnecessary pregnancies and promote happiness and welfare in society as well as in mainly in families. Look at this picture. One family, one girl child. Define family planning. Practice of controlling number of children. The intervals between their births, particularly by means of contraception or voluntary sterilization. Keywords: control, number of children, then interval between the child birth, then means are controlled by voluntary sterilization. Next, attain their desired number of children and spacing and time of birth. It is achieved through use of contraceptive methods and treatment of involuntary infertility. A woman's ability to space and limit her pregnancies, a direct impact on her health and well-being, as well as on outcome of each pregnancy. So this is a classic definition by World Health Organization, included all the matter which is embedded in family planning. Desired number of children, spacing, contraceptives, involuntary infertility treatment. Then aim to promote well-being of individuals in the family, mainly child and mother. Look at this. Then scope of family planning. Space and limit of birth. Then sterility advice. We know that after the marriage, many couple there is no child due to various reasons. One of the first reason is that near relative marriages, same blood groups and biological characters, which cause sterility as well as these congenital issues. Then premarital counseling to advise to how to prevent the sterility. And immediately after the marriage, how to bear the healthy child, etc. Then education regarding parenthood. What are the role of parents on children? Maternity and paternity. Mother and father contribute to. Then sex education to prevent unwanted pregnancies, mainly concerning to prevent the sexually transmitted diseases. The focus on is that promote happier and healthier procreation, and which is named as sexual health. Then screening of pathological conditions. Next scope. Every antenatal mother should be test the laboratory test pathology. Any microorganisms are there, mainly HIV/AIDS test. Nowadays included COVID-19, as well as other test or pathological screening to prevent these diseases in the time of motherhood and promote healthier motherhood and happier motherhood. Then genetic counseling. Students in India, genetic counseling is very, very important. The first reason is that to prevent congenital issues, disorders. Next issue is that the color issue. For example, one father and mother may be in black in color. Husband, which means husband white in color, wife may be black in color. After the marriage, husband and mother may be black in color. After the marriage, after the child bearing, child may be bear pure white color child. Clear about it? Husband and wife black in color, but child pure white in color. What is the main reason for that? The husband says that, the social issue, this is not my child, due to lack of knowledge regarding biology. Color may be transferred from previous generation to next generation. For example, husband, father may be white in color. These issues may happen in our society, Indian society mainly. We had every day hearing these news and conflict between the family members. So genetic counseling is very, very important. First is that regarding the fact about genetics, how they transfer this color from generation to generation, or the genetic factor, maybe diseases or near relative marriages may happen, the genetic disorders, it means congenital disorders, etc. Then premarital counseling and examination is very important nowadays. Counseling means educate about after the marriage what are the issues may happen. Examination means physical examination. For example, after the marriage, a couple able to sexual intercourse or not. The fact is that various marriages, after the marriage, within a week, they divorce, or within a month, divorce. Reason is that husband or wife not fit for the sexual intercourse. So various family issues arise due to these sexual difficulties. So premarital counseling, mainly examination is very important. Then counseling regarding this after the marriage, any problem arise, for example, cultural shock may happen for wife, new wife. Then educate about how to manage the culture in family of their own husband or different places. Then carrying out pregnancy test. Test about after this marriage, and is a free test available now hospitals. The marriage counseling, educate about reality of marriage to prevent the maternal death, as well as this dowry system prevent. Then teaching home economics, which is very important. Students, after the marriage, many families are suffer due to difficult to manage their financial resources. The family planning aim to educate the families, new family couples, how to manage it. Home economics concerning the how to use available resources in just way. For example, a family A, earn 50,000 rupees a month. Family B earn 10,000 a month. But family A spend 75,000 rupees. But families B spend only 7,500 rupees. Which family is best? So family B is saving the money, but family A having more money but more spending. So which is the richest family? Which is happiest family? The family who is saving the money as well as using the resources, available resources in just way and efficiently. For example, in rich people maybe use nutritional concern, the nutritional supplementaries. But poor people can use to vegetable, same kind of nutritional superiority than this supplementary foods. So this is teach about the every home and how to manage, how to maintain balance nutritional diet. Then providing adaptation services. After some families, there is no child, unable to bear child due to the various reasons, biological reason mainly this any issues in this reproductive systems and which cause to sterility. So that couple need to adopt legally, and so advised by the family planning. So do not divorce and living together, adopt a child and make happiness. Then health aspect of family planning. First, women health, including maternal, mortality, morbidity of women, nutritional status, fetal mortality. Then infant and child health, child mortality, child growth and development nutrition, infectious diseases, intelligence, IQ. Then welfare concepts, small family norms, eligible couples, which means a couple 15 to 45 years. Target couple have had 2 to 3 living children. Couple protection rate, percentage of eligible couple effectively protected against childbirth. The nurse's role in family planning. First role, explain all available methods. Then discuss effectiveness and benefits. drawback of each, for example, advantages and disadvantages of each family planning methods. For example, property, condom, as well as contraceptives and subdermal implantation, everything. Discuss how the use feeling about contraception. Each mothers need different, or each couples need different types of this contraception, and have user explain chosen method and say back, which means feedback, which method you like and choose according to their couple wishes. Then clarify any misunderstanding. For example, mainly this many couple may be lot of misunderstanding regarding the childbearing, as we have discussed in the genetic factors, the color of child, or the any issues regarding, for example, some diseases happen, near relatives marriages happen, may congenital disorders, etc. As well as misunderstanding regarding this birth control devices. Next, work with woman and partner, which means husband and wife together, provider of care. Next, reinforcement of education regarding sex education, family health education, nutritional education. Then concern about birth control methods by the nurses. Nurse only administrate all the birth control devices and mainly distribute. Then build trust, acknowledge culture and religious factors. Students, this is very important area. Belief is very, very important. Then some family do not like to use family planning these methods. So we need to concern and try to implement social marketing strategies to promote family planning in every sections of the populations. Then address lifestyle, everyday life, healthier life. Try to eliminate unhealthy lifestyle. So next section, social epidemiology. Terminology, epidemiology. Epi means among, demos means people, logos means scientific study. Meaning, study the disease in defined population. Definition, study of distribution and determinants of health related status, including disease. The application of this study to the control of disease, other health problem in defined population. Aim of social epidemiology. Look at this epidemiological data available here. 10 leading cause of death in the world by percentage. Look at this, 48.2%. Look at this blue in color, prematurity death. Next, maximum 11.2%, lung cancer. Next, 10.6% stroke. And like this. This is a measure of defined population, how many people and their causes of death in defined population. Then aim of social epidemiology. Describe the distribution and size of disease problem in human population. Second, identify etymological factors, origin of disease. 3, provide data. Which data? Regarding the population, and population, these diseases and define the population, which is very important for better planning and implementation. Mainly healthcare planning. Look at this other epidemiological data, which is 10 leading cause of death according to 2011 in the world. 7 million population, these people die due to ischemic heart diseases. Second, 6.2 million stroke. Then 3.2 million low respiratory infections. Then COPD 3 million. Like this. Last is diarrheal disease 1.9 million, HIV AIDS 1.6 million, then bronchus, lung diseases 1.5 million, diabetes mellitus 1.4 million, road injury 1.3 million, and prematurity 1.2 million. So this is according to 2011 objectives of epidemiology. Study frequency of disease, study distribution of disease, determinants of disease. Epidemiological measures incidence, which means number of new cases, prevalence, which means total number of cases, morbidity, total diseases. Explain about morbidity, the proposition of sickness or of specific disease in geographical locality. Morbidity rate looks at the incidence of a disease across a population, geographical location during single year. The importance of population study in nursing. The study of population is very, very important for us, mainly assessment. Nurse should be assessed demographic character of a client, mainly age, sex, religion, education, their language, community, etc. So this assessment very useful for nursing diagnosis. Then only nurse can diagnose what client need and what are the main causes of diseases. Then care. After nurse can give care, client oriented, age oriented, sex oriented, religion oriented, occupation oriented, as well as economic status oriented. So client oriented care, the study of population is very, very important for nursing. Then treatment. To formulate treatment plan, these all the data are fundamental. The main doctors make treatment plan. From the nursing data, nurses collect data and study by the doctors and make care plan and executed by nurses. Treatment plan, how to treat. So every patient needs different types of treatment plan according to their religion, according to their mainly age, sex, biological characters, etc. Then prevention. So this population data is very, very important for us to formulate prevention strategies. Then promotion of health, holistic health, physical health, mental health, and social well-being. The nursing management, for example, mainly nursing educational management, disease management, ward management, hospital management, community management, community health management. This is a fundamental data. The population data is fundamental. The nursing education. Nurses educator need to know about these demographic characteristics of a student nurse. Student coming from which character? It mainly concerning this religion of students, occupation of the parents, which means economic status of the students in the family, as well as the community belong to the family of this student. But this all the data help to, we can student oriented guidance. We can create nursing professionals, quality and efficient nursing professionals. Then patient and health education, client oriented health education. Then counseling. Nurses, a counselor need to assess the population characters, which is essential to guidance, client oriented or client needed guidance. The nursing research, students in research only from the population, started from population. The population, which type of issues there? The sample collected only from the population, which help to mainly every aspect of nursing research. The knowledge of population is fundamental. Mainly first, demographic data is essential in every research. Next is that research problem formulation, data collection, data analysis, interpretation. This is very essential in nursing. Then apply to nursing specialties: maternal health, child health, medical surgical, mental health, and community health nursing. The population study of population and population knowledge should be implemented, applied. When you read the specialty books, every disease is started with population data. For example, diabetes mellitus, you're going to study in the specialty books. This started from in Indian population. Indian book says that Indian population. American book emphasizes that American population. Diabetes mellitus, how many people suffer, and causes like this. So population study is fundamental for every nursing. So every nursing student should be conceptualized. Then conclusion concern. Hence concepts such as demography, population control affect or influence, mainly population explosion affect the health status of people. It is a social medicine. Population is a medicine. Population control is a medicine. Can control the diseases, cure the disease by means of change the means of population, mainly population control. Then essential to apply to nursing, every aspect of nursing already we had learned: care, cure, prevention, promotion, and rehabilitation. Then solve social problems. Mainly we need to think about healthcare problems as well as other allied problems, including poverty, unemployment, illiteracy, etc. Then promote, which is fundamental for promote peace and development, mainly sustainable development. The study of population is very, very essential. Then important questions, review questions. Define following: population, demography, sex ratio, density of population, family size, optimum theory, population explosion, social epidemiology. Then list the following: uses of study of population, relationship, society, population, demographic characteristics, factors responsible for rapid population growth, the importance of population study in nursing, and evil effects of overpopulation, Need of population control. Methods of population control. Goals of family welfare program. Aim of social epidemiology. Theories of population. Determinants of population change. Define difference between Malthus theory and neo-Malthusian theory. Society and population. Then short notes. Uses of study of population. Population distribution in India. World population trend. Demographic characteristics. Students, this question most important. Population control measures. Theories of population. Overpopulation. Population explosion in India. Its impact on health. Family welfare program in India. Social epidemiology. Then essay on. Define population, discuss population explosion. And in India, its impact on health and population control measures. Students, this question is very, very important for essay question. Population explosion is repeated in the final examinations. Okay, so this population study is over. Next, we are going to discussion time, questioning time. Important words only enough, okay? Important words. Gomadi, time is enough for you.
Controlling number of children between the birth contraception of voluntary sterilization.
Excellent answer. Yes. Control the family planning means plan to control the population by means of this sterilization and aim to space between mainly increasing the space between the child to promote happier motherhood. I appreciate your answer, Gomadi. Social epidemiology. The highlights of today's discussion is that the role of nurse, this every role done by the nurse in the family planning, will educate the family members, premarital counseling, and education, the examinations. So these are the data knowledge very important for nursing students, and which is essential applicable to other nursing discipline, mainly maternal health, as well as medical surgical, as well as child health. This should be utilize this knowledge. Okay, thank you everyone. Have a wonderful day. Have a nice day. Enjoy the day.
Thank you, sir.
Yes.
Thank you.
Yes.
Thank you.
Abhinaya. Yes, Nihila. Aradhi. Yes.
Thank you, sir.
Yes.
Thank you, sir.
Sona.
Thank you, sir.
Yes.